Have you been told you have a horizontal meniscus tear? What does that mean? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. So I get a lot of questions and I see a lot of patients who have horizontal meniscus tears. So let's take a look at this knee model. This is the thigh bone, the femur. This is the shin bone, the tibia. This is the fibula, the outer leg bone. And then you have your kneecap. And so the knee is made out of those four bones. If we look, you have cartilage on the end of the bone that looks kind of like the white on the end of a chicken bone. That's like the tread on a tire. When that wears down, that's what arthritis is. But you also have these meniscus cartilages in between the bones. And horizontal is this direction, and vertical is up and down. So up and down versus side to side. So you can have a vertical tear, an up and down tear, okay? And that's a vertical tear. And this one happens to be also a quote unquote bucket handle because it kind of looks like a bucket handle going back and forth. You also have a vertical tear right here. You can see this probe that I have in here going, straight up and down, okay? Now, horizontal is just exactly what it says. It's horizontal. So if you look closely here, you see that I have this probe in here, and this tear goes horizontally. So it goes this direction. So the problem with most horizontal tears is they don't heal as well. And you also have the three zones in the meniscus where there's a good blood supply in the outer third. We call that the red zone. There's a decent blood supply in the middle third. We call that the red-white zone because white means it's not very vascular, red means it's vascular. And then in the inner third, there is the white zone where there's no blood supply, and that usually, even if you put stitches in it, it's not going to heal well. So most horizontal tears go through all three zones, not all of them. And so you can try to sew it back together, and this part might heal and this part might heal, but this part might not. So sometimes we have to trim out part of that horizontal tear and try to sew it back together. But these ones right here, these vertical tears, especially along the edge where there's a good blood supply, you just put some stitches in there and that has about an 85 to 90% chance of healing. If we want to increase the rate of healing, we feel that using PRP, platelet-rich plasma, and bone marrow cells that has stem cells and other cells that help the stem cells, and even laser therapy, which increases blood flow, can help these things heal. So now let's look at and see what this horizontal tear looks like on an MRI. So on the MRI, you have this view right here, and you can actually kind of see, this is on the inner side. Actually, this is probably a better view of it. So here's your medial meniscus, and here's your medial meniscus, this black thing. And then here's the lateral meniscus, okay? And that's actually a pretty good MRI to show the medial and lateral meniscus. If there was a vertical tear, an up and down tear, you might actually see it on this view. This is called the axial view, the cross-sectional view, but usually that's not the best view for looking at the meniscus. This is called a sagittal view. On the side, here's the femur, the thigh bone, here's the tibia, the shin bone, and the meniscus should look black and triangular. So if you look at the front part of the meniscus, because there's a front and a back, anterior horn and posterior horn, the front part looks like a little triangle, should be black, triangular, no bright white lines. The back part should be black, triangular, no bright white lines. Oh, I see a bright white line. And guess what? It's horizontal, it's not vertical, it's not going up and down. So that right there looks like a vertical, at least partial tearing, maybe not a full tear, we don't know, because you have to see this white line reach the surface. And you don't always see that with a horizontal tear, but a lot of times they do reach the surface and they're a little harder to get to heal. If you look over here, this is more of a front view, what we call a coronal view. And so again, you can see the meniscus right here on the outer side, this black kind of cushion in between the two bones, no white lines within it, but you see a white line right here, and it's horizontal, it's not vertical. Now, if you had a nice vertical line up and down in the edge and you put stitches in it and you put some injection in it, it might heal really, really well. So this, to me, now looking at this particular example, if you look real close, I don't necessarily see that reaching all the way to the surface. Now that actually may be a good thing. You can actually have a partial tear within the intrasubstance, within the substance of the meniscus, and it might not actually show up, even if you went in there with an arthroscope and looked. If that doesn't go all the way to the surface, that meniscus might look good on the top and on the bottom, but deep down inside it doesn't look good, and that's where an MRI helps. The doctors might say, oh, I can go in there and look and see if it's really a tear. Well, if it's not a full tear that goes to the surface and it's a partial tear, then that is not something you're going to see arthroscopically. So you can see it real well in the MRI. Sometimes on these, if that's what we really think it is, we might inject PRP in bone marrow using an ultrasound to look right in this area and get it injected into here, and it'll fill up, and we can a lot of times get that to heal. This is kind of a cool case, an interesting case. I'd be interested to hear what this person's symptoms are, but usually with a horizontal tear like this, I don't see a piece flipping back and forth like you do with these bucket handle ones, and it usually doesn't cause locking, but it can cause pain. And so that's a great example of a horizontal meniscus tear. Hopefully you understand that. I get a lot of people asking me questions about this. And if you have any other questions, feel free to like, comment, subscribe, follow us. And again, we get a lot of our questions from you, so please send them in. Thank you.